This is CGTN, China Global Television Network.
African coronavirus cases rise above 1,000 as most nations begin lockdowns. Italy and Spain battle Europe's heaviest pandemic cases as shortages bite. And Nigeria tracing people who had contact with a Lassa fever patient who died in Abuja. This is CGTN. Welcome to Africa Live with me, Beatrice Marshall in Nairobi. Also ahead on the program, Ethiopian Airlines says it is now focusing on cargo as COVID-19 hits passenger transport. And in your sports, coronavirus pandemic cripples major sporting events across Africa. Over 1,000 COVID-19 cases have been reported in 41 African countries so far. That's according to the Africa Centers for Disease Control and Prevention. Let's now take a look at the numbers by region. Northern Africa has the highest number of confirmed cases. Egypt's cases have jumped to 294 from 285. Algeria now has 139 cases of the coronavirus. Tunisia registered 6 new cases, raising the total to 60. In West Africa, Senegal has the highest number of infections. Togo's cases, on the other hand, have risen to 16. Nigeria has 26 confirmed cases, up from 22. In Eastern Africa, Uganda reported its first case. Rwanda so far has the highest number of confirmed cases in the region. In Central Africa, Cameroon has the highest number in the Great Lakes region with 40 people infected. The DRC also saw a rise in cases with 30 now confirmed. In Southern Africa, Mauritius has reported 4 new cases and confirmed its first death. South Africa remains the worst affected with 240 cases. The global death toll and cases continue to surge. Data from Johns Hopkins University show more than 307,000 people have been infected. Italy has the largest outbreak outside China. It saw records in new daily infections and deaths on Saturday. Spain is the second hardest hit in Europe with more than 25,000 infections. The United States reported more than 7,000 new cases, bringing the total to over 26,000. The country has become the third most infected country after China and Italy. Iran, the worst hit in the Middle East, has reported more than 20,000 cases and over 1,500 deaths. South Korea has more than 8,800 cases, while the death toll surpasses 100. The Chinese mainland registered 1 new locally transmitted case in Guangzhou. The patient was in close contact with imported cases. China has added 47 imported cases. Hubei province has not reported any new case, confirmed or suspected. Nearly 90% of patients in China have recovered. Now, with nearly 800 deaths in the last 24 hours, Italy's resources are being stretched. A team of 52 doctors from Cuba are being flown to the worst-hit region of Lombardy to assist local medics attending to patients. There are over 2,800 COVID-19 patients in intensive care in Italy. At least 6,000 people have recovered, according to the Italian Civilian Protection Agency. Earlier, we spoke to journalist Laura Silvia, and she updated us on the latest from Italy.
We are facing a crisis that we never faced after the Second World War. The nation should be prepared to do any sacrifice. And the latest are that the Prime Minister is tightening all the previous measures. So everything will be stopped. All the production chain will shut down, except for supermarkets, grocery shops, and all the fields on the agricultural end. Then only post offices will be open and banks. So everything should shut down, especially in the north of Italy, where the crisis is really, really severe. Citizens are now very worried, and there's no space for any complaint about also the tightening also of the movement and every activity the citizens were doing. the government issued a call for doctors, volunteers, hiring 300 doctors in the civil protection, plus 4 field hospitals were already built in 4 northern cities of Italy, Crema, Cremona, Piacenza, and Brescia, and in Bergamo. One of these field hospitals is run by an evangelical NGO. Another one will have the help of Doctors Without Borders. In a third one, there are expected medics from Cuba who are experts in the Ebola pandemics. Everything is moving, but the problem is the field hospitals will not be enough, because all the hospitals, the normal one, are all overwhelmed, and the field hospital will have capacity around only 400 beds and only very few in the intensive care. In these days, we saw even an army, a column of army vehicle carrying dead bodies in coffins. And this is how the situation is in Bergamo, in the city of Bergamo. And about people who are testing positive to the virus, well, what's happened is that they wait at home until the respiratory crisis became very, very strong. Then they call the ambulance and they have to go to hospitals. But what is happening in all these hospitals, very overwhelmed, is that the doctor, they need to do tough decisions. So in general, they send back home the elders, the old people, or people who have already previous diseases, and they admit others. And this is something that they didn't want to do, of course. But in this situation, which is compared a little bit to wars, well, they should do this.
Well, Spain reported nearly 5,000 new COVID-19 cases in the past 24 hours. The country is now only behind China and Italy in the number of confirmed cases. The government is racing to build temporary hospitals to handle the increasing number of patients. Our correspondent Rahul Pathak joins us now from Madrid. Rahul, can you describe the situation in Spain for us?
I will do in a second, but we've just received news in the last few moments that the national lockdown here in Spain has been extended by another 15 days. So we're currently halfway through the first lockdown. They're going to wait for that to finish in another week's time, and then another 15 days will kick in. That has literally just happened and been confirmed in the last few minutes, announced by the government of Pedro Sanchez. But to go back to your question, what the situation is like, well, just as proven by the extension to the lockdown, it's pretty bad. Pedro Sanchez, the Prime Minister, gave an address to the country yesterday, and he warned that the worst was yet to come. He warned of tough times or tough days ahead for people in Spain. You were talking about these huge military hospitals that are being set up. There's a big one that's being set up here in Madrid near the airports. About 5,500 beds are going to be housed there, and it's actually at the IFEMA Convention Centre, which I don't know if you remember was used for the recent UN Climate Change Summit back in December. The nationalising of the private healthcare system has also been kicking in. That happened 6 days ago, but it hasn't really had the desired effect. ICU, intensive care units are really buckling under the strain. I read a quote from a newspaper article this morning. It was really heartbreaking, from a Madrid-based emergency room doctor, and he said that already they were having to choose who they intubated. They just can't use it on everyone anymore. Retired doctors, and at the other end of the spectrum, medical students are being drafted in to help with the country's healthcare system. And any companies that could capable of producing medical equipment, so things like gloves, surgical masks, they've been asked to get in touch with the government straight away.
All right. As each affected country in Europe struggles, Rahul, to deal with the virus, there have been questions about what exactly European Union members are doing to assist each other through these crises, because most of them are also under great strain. Is Spain getting any assistance?
Well, the European Commission on Friday, they announced that they triggered something called the General Escape Clause. Now, that basically lifts stringent spending rules and allows countries to run up big deficits in times of crisis, and that's the first time that's ever been allowed in the history of the European Union. And just over a week ago, European leaders came together and said that they would spend hundreds of billions of euros to help countries in terms of preventing making sure that the coronavirus outbreak didn't start a Europe-wide recession. But in terms of actual aid on the ground coming into the country, I've seen very little of it, frankly, from other EU countries. I mean, China sent a big aid package last week, but countries, especially like Italy, have been highly critical of the lack of help that they say that they've been receiving or not been receiving from their EU partners.
All right, Rahul Pathak joining us there from Madrid. Thank you. Well, back home, after Uganda confirmed its first case of COVID-19, President Yoweri Museveni this evening set to issue more measures to prevent the further spread of the virus. The government has already shut down the airports and national borders. Let's get more now from Isabel Nakiria. She's joining us live from Kampala. Isabel, the first coronavirus case has been reported now from Uganda. What more can you tell us about the patient and the government's plans after the confirmation?
We've been told that the Ugandan businessman arrived from Dubai on Saturday morning at around 2 a.m. aboard an Ethiopian Airlines flight. And when he arrived at the passenger terminal, he was immediately detected to have high temperatures of over 37 degrees. He was isolated and later taken into the hospital at Entebbe, where his temperature did not go down. The health ministry says he is not coughing and neither does he have flu, but the temperature is high. But we've also been told that he's still in stable condition and he's receiving treatment. We also know that all the passengers that came with him aboard that flight have been found out, their passports have been detained, and they will be contacted and probably tested and put in quarantine if it's necessary.
Isabel, how is the closure of borders, though, and the airport expected to impact Ugandans? Because those were some of the measures that President Museveni announced yesterday.
I think the closure of borders have disrupted a number of businesses. Even before the border was closed, a number of businesses were already disrupted. Loss of revenues and a slowdown in business, especially the SMEs, the small business people who depend on stocking their goods from countries outside Uganda that are already affected by the coronavirus. So many business people cannot move out or move in to bring in goods, and they are running low in stocks. And so some of them had already got alternative routes like Thailand, where they would go and restock their goods, but that too can't happen now. And other sectors like the tourism sector that had already experienced a lot of cancellations, tour operators had told us that many of them received cancellations from the packages that they do offer, and this has affected mostly the hotels, restaurants, bars that of course have also been shut down. And you know, tourism is one of Uganda's biggest revenue earners. Tax collections also will definitely get impacted negatively because of international trade. 42% of Uganda's revenues are got from international trade through import and excise duties, but that will definitely impact it negatively. So there's going to be a slowdown in many of the sectors in the country as people cannot move out or move into the country.
All right, Isabel Nakiria joining us with that update from Kampala. Meanwhile, Nigeria has also announced 4 new cases of coronavirus, bringing its total confirmed cases to 26. The continent's most populous country on Saturday announced it is closing airports to all incoming international flights for 1 month. One other measure meant to protect citizens was the advice to avoid large gatherings in churches and mosques. Deji Badmus is joining us live now from Lagos for more on this. Deji, Nigeria is considered quite religious. Are citizens respecting the advice to stay away from churches today?
Absolutely, Beatrice. Churches, especially here in Lagos where I'm, virtually all of the churches have closed, actually didn't open for the day, and people chose to stay at home. There's a church right behind me, as you can see. Normally at this time, the church will be packed full, but the church hasn't opened today. So there's been, I would say, total compliance with the directive from the government and, of course, the NCDC here. And a lot of people, too, you know, were actually shocked to when more cases were announced earlier in the day. So I think that would have further, encouraged people to stay at home. So the compliance level is actually high, especially here in Lagos. We've not seen any church at all that has opened. In some places where some churches managed to open, we understand not more than 20 persons, the way the government directed now, were allowed into the church. So the level of compliance here is high. What some of the bigger churches have done is to actually transmit their service now via satellite, and some actually did live streaming. So their members were able to follow the service at home, and their pastors were able to talk to them. So Beatrice, it's the compliance level is high, I must say that.
So what other measures are there on the ground, though, Deji, to limit the spread of COVID-19?
Well, you did talk about limiting gathering. Part of course, the reasons why churches have not opened today is part of that measure. Beginning from Monday, the government has announced that it would be suspending train services. So the trains would not work for over a month, so we understand. And the Federal Road Safety Agency here, that's the agency in charge of road transport in this country, has asked drivers to avoid overloading, that they are going to increase their check now on drivers to ensure their vehicles are not overloaded. The government is also moving to, the government has asked restaurants actually to cut down on the number of persons they are allowed to come in and sit down to eat. Schools, of course, have closed. Some that are still open will close down effectively from Monday. So several measures, and I think as we move on, the government has said as we move on, as we get further spike in the number, then it might announce further measures. There is a possibility, but the government is not looking at that at the moment. There's a chance, it's not impossible, that if we have further spikes in the number, especially for a city like Lagos, you never can rule out the possibility of a lockdown. And that's why we've seen some level of panic buying. People have been rushing to stores, to markets, to stock up, because they suspect that the numbers of confirmed cases now might go up, and that a lockdown might be inevitable. But then, of course, the government has said people should not panic at all, that it's on top of the situation, and that further measures would be announced on a case-by-case basis. As the numbers go up, the government would announce further measures. So there's a likelihood, if we have any confirmation between now and tomorrow, then we might get further directives from the government as to what measure it will be taking next.
All right, Deji Badmus joining us there from Lagos in Nigeria. And now to Ethiopia, where masks, test kits and protective suits donated by Chinese billionaire and co-founder of Alibaba, Jack Ma, have arrived in the country's capital, Addis Ababa. The 103 tons of donations contain testing kits, masks and more, and are meant to help the African continent tackle COVID-19. They will be distributed to the whole continent in 5 days. Ethiopia's Prime Minister Abiy Ahmed will oversee the distribution of the supplies to other African countries. Jack Ma has also pledged to provide online training material for clinical treatments. Well, let's cross over now to Addis Ababa, from where Girum Chala is joining me live. Girum, a Chinese billionaire Jack Ma's donations have arrived. Tell us more about the donation and what's the plan to get the supplies to the rest of Africa.
Thank you very much, Beatrice. As you've said, Jack Ma, Chinese billionaire founder of Alibaba himself, as he promised, has delivered the medical kits to Africa via the Bole International Airport here in Addis Ababa. The 103,000 kilograms of masks and other medical equipments are now going to be distributed across the continent. By the way, to just shed more light on which specific items are what number, these testing kits are going to be 1.1 million, which have just arrived. 6 million masks and 60,000 protective suits have already been delivered here in the cargo and shall be distributed across the continent. Each and every country will get 20,000 test kits, 100,000 medical masks and 1,000 protective suits for every country in Africa, as I was saying earlier. Now, according to Ethiopian Airlines, which has the responsibility of distributing these medical kits across the continent, distribution will begin tomorrow. They are going to use passenger planes. They are going to use the bottom of the plane, the passenger planes, to distribute these medical kits to the countries which they are flying at the moment. And to those countries they are not flying, they are going to use Boeing 737-800 freighters to deliver these items as soon as possible. I was also talking to the Africa Centers for Disease Control Director General earlier, and he said this is remarkable and it will help Africa defeat COVID-19 before it really damages perhaps the health situation of the continent, obviously killing people at the same time. So it's an exciting moment. By the way, this initiative is called Prime Minister Abiy Ahmed Alibaba founder Jack Ma initiative to reverse COVID-19 from Africa. So first delivery, as promised, has been made and distribution will begin tomorrow, Monday.
All right, Girum Chala, following the developments for us from Addis Ababa. Thank you. In the meantime, though, Tunisian authorities have ordered a general lockdown. It will last from Sunday to April the 4th. CGTN's Adnan Chauchi has more.
The Minister of Health said the situation requires a global approach within the framework of international organizations, especially the United Nations, since national measures remain insufficient in facing the threat to the world.
The state will make sure that all patients or suspected cases of infection with COVID-19 get the necessary medical assistance at home and treatment at the hospital. We do not have enough means, but we can face this pandemic if all citizens respect the prevention measures.
Following the National Security Council meeting at the Carthage Palace, President Kais Saied announced a general lockdown in Tunisia, except in cases of force majeure.
General lockdown means that all citizens and residents in Tunisia stay at home and go out only to meet their basic needs and in cases of necessity, such as provision and health treatment.
The National Security Council also decided after its meeting at the Carthage Palace to ban intercity travel, except in cases of extreme necessity, and to shut down large industrial zones.
Given the increase in cases, other means are required to avoid mass gatherings and travel, along with conventional health measures. Basic services will be dispensed to everyone.
The head of state said that the public prosecutor's office and the security forces are called upon to intervene urgently to put an end to food monopoly, which harms the citizens' purchasing power. The National Security Council and the Supreme Council of the Armies also decided to resort to requisition to secure the normal activity of vital facilities and dedicate new spaces for quarantine, including hotels and cruise ships. Adnan Chauchi, CGTN, Tunis.
Now, despite facing security challenges, Somalia says it is ready to handle any COVID-19 patients. The government has set up several designated quarantine facilities for suspected cases. From Mogadishu, CGTN's Abdulaziz Bilo has more.
Announcing his government's plans to contain the spread of coronavirus, Prime Minister Hassan Ali Khaire says his administration has set aside $5 million for that purpose after the country recorded its first positive case.
The government of Somalia has set up a quarantine facility to prevent the spread or potential outbreak of the virus. The centers will host suspected cases. We plan to create 2 or 3 quarantine centers, but for now, Matini Hospital will serve as a quarantine facility.
The government ordered the closure of all schools and universities across the country. It has also discouraged public gatherings to prevent the chances of COVID-19 spreading. But on Saturday, the Ministry of Civil Aviation and Air Transport announced a 2-day respite on the suspension to allow Somali nationals stranded at international airports a chance to return. Airlines given a green light to land include those from airports in Kenya, Ethiopia and the United Arab Emirates. Cargo flights have also been banned with exemption to humanitarian aid and emergency flights. On the streets of the capital, locals have welcomed efforts by the government to contain COVID-19.
It's our responsibility to ensure basic hygiene everywhere, at home, For our children, make sure we live in a clean place, and God willing, we hope this disease doesn't reach us.
There are always two ways to dealing with any crisis: prevention and treatment. There is no known remedy for coronavirus, therefore we must ensure we abide by health directives.
Traders have been warned against taking advantage of the ongoing situation to hike prices of basic items such as food and hygiene equipments. Prices of hand sanitizers in Mogadishu has drastically increased since the government declared the first positive case of coronavirus last week.
We have enough food and medicine to last us for a while. The government is implementing steps to contain the spread of the virus. We've had extensive talks with the business community, and they have agreed to cooperate with the government as we seek to tackle the spread of coronavirus.
For now, screening at all airports continues. The government says early detection is the best way to prevent the virus from spreading to areas beyond the government's control. Abdul Aziz Bilo, CGTN, Mogadishu, Somalia.
South Africa recorded 240 confirmed cases of the COVID-19 virus. The president declared a national state of disaster from last Sunday. Lindiwe Zulu, the Minister for Social Development, has commended China for being transparent and sharing information about the virus. The minister says this allowed South Africa to step up its measures to try and halt the spread of the pandemic.
I think from a South African perspective, we can confidently say China did the right thing. The very fact that the ambassador of China in South Africa was able to act and request for the necessary meetings both at political party level in the ANC as well as in government was already a step to say, here is something that's coming, let's step up and do something about it. Secondly, China needed to do what it needed to do in its own space as China because they understand their own situation. I think China has got the largest population in the world. So you can imagine if China didn't act by firstly being open about it, secondly by speaking to the international organizations such as WHO, by speaking to the United Nations itself and saying we have a problem. Imagine if they kept quiet about it. Where would the world be today?
You're watching Africa Live. Still ahead on the program. Nigeria tracing people who had contact with a Lassa fever patient who died in Abuja. And a young Ugandan climate campaigner calls on the world to plant more trees now.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
A new disease spreading quickly around the world with no respect for borders.
This is not a drill.
But is Africa prepared? And is the public well informed?
As journalists, we have to separate fact from fiction.
CGTN takes an in-depth look into Africa's readiness and population awareness as the coronavirus outbreak continues to unfold.
What safety measures are in place at Africa's international airports?
And what habits can we adopt in the home to keep us safe out in the world?
We take you on a journey through Africa's efforts to understand, isolate and battle COVID-19. Only on CGTN.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there. To see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe. reaching people across the globe. CGTN. See the difference.
Nigeria has begun tracing all people who were in contact with the Lassa fever patient before he died in Abuja. There has been a steady rise in the number of Lassa fever cases in the country over the past 5 years. And as CGTN's Kelechi Emekalam reports, authorities have stepped up the training of health workers to handle the outbreak.
The Maitama District Hospital in Nigeria's capital, Abuja. A man was brought here with symptoms of malaria and hemorrhagic fever. He later died and test results showed he was affected by Lassa fever. So hospital authorities have closed operations in the place where he was isolated, and the entire hospital is currently being decontaminated.
We are directed to disinfect anywhere they are isolated so that whatever the product that came out of the patient in form of fluid or vomit, once you disinfect with 0.5 household disinfectant, such whatever microorganisms are taken care of.
Lassa fever is a viral hemorrhagic illness transmitted through food or household items contaminated with urine or feces of infected mastomys rats. Person-to-person infections and laboratory transmissions can also occur. Health authorities have begun contact tracing measures, beginning with health workers who directly handle the case. For now, all direct and indirect contacts are being placed on the public health monitoring list.
That the group C, the group that we are really out for, are those that they have access to the patient, access to fluid from the patient, access from excreta from the patient, urine from patient, vomiters from patient. We've commenced the appropriate group on this drug when we are monitoring order, using thermometers and all that. The fear is with the family members that are, and the primary health care where he was first taken care of. Bear in mind that it's a rural area.
Since January this year, there have been over 470 confirmed cases of Lassa fever and more than 70 deaths. Authorities are beefing up efforts in the healthcare sector to stop the spread of the disease and other emerging diseases like coronavirus. They recommend personal hygiene and routine observation of safety health guidelines. Kelechi Emekalam, CGTN Abuja, Nigeria.
As the world marked International Day of Forests yesterday, Uganda's young climate campaigner Leah Namugerwa called on global leaders to plant more trees. In Uganda, the Environment Ministry says the country's forest cover has shrunk to 8% from 24% in the 1990s. CGTN's Isabel Nakiria reports.
Leah Namugerwa is trying to regrow Uganda's forest cover. She's celebrating the World Forest Day by saving Uganda from deforestation.
In a year, 1.3 billion trees are cut down, which is really a big problem. So as a way of fighting deforestation, I decided to plant trees today and to give back to the nature and to bring back the glory that Uganda had.
The National Forestry Authority estimates Uganda loses about 100 hectares of forest cover every year. Most of the trees cut are used for wood fuel and construction material. Leah wants to revive Uganda's forest cover by rallying young people to plant about 1 billion trees annually. She hopes her campaign will reverse the trend of tree cutting. Leah's concern now is that global leaders are paying less attention to the continuing felling of trees and leaving the burden to young people.
It worries me that the leaders are not caring, or the adults are not caring about what is happening and the effects that they're bringing to the world. It worries me hard that they're thinking about their selfish desires, but they're not thinking about their children.
The government has set a target of recovering 16% trees that have been lost in the past 2 decades by 2040, but say it will need collective efforts. Campaigners want to see more young people greening the environment.
if people are dying of malnutrition and we are losing out on green vegetation cover, and we are doing little as adults to combat this looming crisis, we looked at around ourselves and realized that the best we can do is to pick the children and place this mantle on them for two reasons. One, the future belongs to them.
For now, Leah says she will continue pushing leaders to restore vegetation cover by planting a tree each day, with the hope of replacing all lost trees to combat climate change. Isabel Nakiria, CGTN, Kampala, Uganda.
You're watching Africa Live, still ahead on the program. Ethiopian Airlines says it is now focusing on cargo as COVID-19 hits passenger transport. And a South African company working on technology to adopt the World Health Organization's WhatsApp COVID-19 alert service. A Nigerian airline, Arik Air, has announced a temporary suspension of flights to all its routes to the West African region as part of efforts to help curb the spread of the coronavirus. Our correspondent Phil Ihaza reports from Abuja.
Chief Executive Officer of Arik Air, Captain Roy Ilegbodu, said with effect from Monday, March 23, all its flights to the West African region, including Ghana, Liberia and Senegal, will be suspended. According to the management, the safety and well-being of its personnel and customers are paramount at this critical time. The airline also apologized to customers whose travel plans may have been affected by the suspension of flights and promised to mitigate the effects by ensuring a prompt refund of tickets. The federal government on Wednesday announced the restrictions of entry into the country for travelers from 13 high-risk COVID-19 countries, including the US, UK, China, Germany, Italy, Japan and France. The flight restrictions are, however, to commence on Saturday, March 21. The travel restriction was announced after the government confirmed 5 new cases of the disease, all travelers from the UK and the US. This brings the total number of confirmed coronavirus cases in Nigeria to 8, although one person has fully recovered and has since been discharged. Phil Ihaza, CGTN, Abuja.
Meanwhile, Ethiopian Airlines says it has lost at least $190 million so far and has parked at least 25% of its fleet due to the coronavirus. Speaking exclusively to CGTN's Girom Chala, Ethiopian Airlines Group CEO Tewolde Gabremariam, however, insists the airline is doing just fine as it's focusing more on cargo and hotel services.
It's a very, very tough time for the airline industry. According to industry experts, this is the most challenging time in the history of the aviation industry. So we expect a lot of casualties in the coming few months. So like any airline, we are also affected. As you said, passengers are not comfortable to fly, so there is fear and panic all over the world. On top of that, as you said, some governments have taken very drastic actions. So we have like more than 20 countries who have shut their airspace as we speak, so we don't fly. There are also countries or stations that we have closed on our own because of operational reasons. We don't fly to Milan right now. We have stopped to Spain, Dublin, Geneva, and so on for various reasons. Milan, for that matter, is the epicenter of all the problems. So, I mean, the spread, the highest number of spread in Europe, so we stopped there. So, in the midst of this pandemic and serious problems, so we have reduced our capacity by 25 to 30%. We have parked some airplanes around 25% of our fleet. And it's a very, very trying time.
So how is ET continuing doing business?
We have developed the resilience and the ability to come out of this similar problems. So right now, what we are doing is we are using our flexibility, agility, so turning our focus to what can be done. For instance, we have refocused on cargo, which is doing very well right now because of the supply chain disruption, particularly which took place in China in February, end of January and February. So China was almost closed for a month and a half.
But then again, the future also could be scary. And is there any plan in the loop for you to continue your current success?
You know, the industry, as I said, is in a very survival mode. So I would say that there will be casualties and definitely will not be one of them. Another group of airlines will be maybe surviving this challenge through heavy dosage of government subsidy. Again, we will not be one of those airlines. There will be very few airlines where they will be able to manage on their own internal resources, and we are confident that we will do that.
Still in Ethiopia, the demand for lemon, ginger and garlic has risen significantly since the start of the coronavirus pandemic. The three ingredients are a component of a traditional drink called dawa. It is believed to help boost the immune system and even cure colds. CGTN's Tulisha Balala has more.
This is Atikilt Terra Market in Addis Ababa. The demand and price for lemon, ginger and garlic have risen here since the outbreak of the coronavirus pandemic. The three ingredients are used to make the traditional dawa drink.
For sure, this will help me. This is naturally rich in vitamin C and full of natural herbs like lemon, ginger, garlic and honey, and seasoning flavors in addition to these natural herbs. I often use it to recover from the flu, and by the same token, it will certainly help me fight corona as well.
Shoppers at this vegetable market fill their bags with these ingredients. Amid the fears of coronavirus, some customers are comfortable with the new prices, while some are not.
You know why they've hiked the price? It's after the outbreak of corona here. For example, garlic is nearly $5 per kilo. It is right here, you can check. It used to be just $1.80. Lemon was $1.50. Today I bought a kilo for close to $5.
A kilo of lemons costs $4. But I don't mind spending even more because it's for my health. Your health is more important than anything. I came here to buy lemon and garlic because the talk of the price is over-exaggerated in my area. But it's not that much. It's an okay price.
Sellers, however, say they are serving the public by providing produce needed for medical purposes.
You won't see a lemon seller now because they are being hunted and arrested because of hiking prices. But you shouldn't blame them because the wholesalers have increased the prices too. We are not bothered only about today. We also want to sustain our business in the future. We are trying to help the public because these are wanted for medicinal purposes. Look at me, for example. I'm protecting myself by inserting garlic in one side of my nose and ginger in the other. We didn't increase the price too much. It is just a bit.
Africa has now reported more than 1,000 cases of coronavirus. A growing number of African countries are increasing restrictive measures to try halt the spread of the virus. With a hot drink made from lemon, ginger and garlic, Ethiopians are just doing what they can to head off any flu symptoms. Tuli Shabalala, CGTN.
And to increase access to reliable information about COVID-19, the World Health Organization has launched a WhatsApp Health Alert messaging service, and a South African company has been instrumental in developing the technology to make this a reality. It was first launched by the National Department of Health in South Africa in mid-March. The application delivers accurate, up-to-date information to people across South Africa during the current COVID-19 pandemic.
So we've been engaging with the WHO, particularly their Be Healthy, Be Mobile program for some time. And in developing the South African platform, we reached out to them to ask for permission to use some of their content because we felt that it was the leading content in the world. When they saw the application that we were developing, they immediately forwarded it on to their team. And we received a call asking if we could do something similar for the WHO. It means a lot to Prekilt. You know, we're a South African company. We were founded here. We do operate in a number of different countries, but something that is on the world stage and is something that anyone can operate internationally and endorsed by a body like the WHO is an incredible opportunity for us.
Now, if you love cycling and smoothies, you'll find this interesting. Zahir Davids from the Western Cape in South Africa came up with an innovative way to make smoothies while cycling. Sumitra Naidu visited him.
My name is Zahir Davids, founder and owner of Flywheel Custom Chariots. We design and manufacture custom bikes. I always followed the whole lowrider culture in LA where the guys used to customize the old classic muscle cars, and I was intrigued by the amount of detail and craftsmanship that went into these cars and always dreamed of building a bicycle one day. Flywheel smoothie bikes basically started about 3-4 years ago. Basically the whole entire bike is built from scratch. The frame is fabricated from the ground up. It's all pedal powered. There's no electric drive. All you have to do is pour in 200 ml juice and your one smoothie pack. In order to make the perfect consistency of smoothie, we need to cycle for 400 meters. So one smoothie will take you on an average of about 45 seconds. And our smoothie is done. We've been quite busy doing bookings for wellness days, corporate activation.
Let's now take a look at your sports news. Here's what's coming up. The coronavirus pandemic cripples major sporting events across Africa.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Stakeholders in South African football are feeling the financial pinch of the suspension of all domestic activity due to the COVID-19 pandemic. The Premier Soccer League cash cow will be the most affected, with the resumption of the 2019-2020 season unlikely. Here's CS Du Plessis with a story.
There's no doubt that the financial implications of the postponement of all football activities will be felt across the Rainbow Nation. The suspension of fixtures has a knock-on effect that not only the players, fans and club owners, but also broadcasters have to endure, resulting in a loss of income across the board and on various levels.
The World Cup is a big revenue, AFCON is a big revenue, and now we can't get that revenue because the matches are postponed. Under 17, under 20, and our Olympic team. So we have 5 teams that would have generated a lot of revenue for us. But we understand we have to put the interest of the players first.
The PSL toyed with the idea of playing games behind closed doors, but this was short-lived and a decision was made to follow SAFA's instructions to suspend all football activities for the foreseeable future.
Looking at the situation,
And if we are not acting responsibly,